Recording in progress.
Good afternoon. I'd like to call this meeting to order at 1 p.m. on Thursday, August 28th, 2025 for the District Board of Health. I'd like to ask the clerk if we could have a roll call to determine quorum.
Vice Chair Andreola.
Present.
Board Member Anderson.
Here.
Board Member Brown is absent. Dr. Danko is not present. Board Member Driscoll.
Here.
Dr. Duarte.
Here.
And Chair Reese is absent. We do have a quorum.
Thank you. I'd like to go ahead and close item 1 and move to the Pledge of Allegiance. And Ms. Dixon, I'm going to ask if you would like to lead us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll move now to public comment. Do we have any public comment?
The public comment statement, all public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. There are currently no requests or Zoom users requesting public comment.
Thank you. Just for establishing the record, is anyone online? Thank you. Okay, we'll move now to the approval of the agenda. I'd like to entertain a motion at this time. We have a motion by Mr. Driscoll. May I have a second?
Second.
Second by Mr. Anderson. All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. We'll move now to, it's on our screen, so we can be official. Not displaying the results, I believe it was unanimous. Yes, thank you. We'll move now to item number 5, which are recognitions. Dr. Kinsley.
Thank you. First up, we have Erin Dixon presenting retirements and years of service.
Good afternoon. For the record, Erin Dixon. We have 2 retirements. One is Maria Magana. She is an office specialist with CCHS. She's been with us for 30 and a half years. Maria is one of those individuals that has absolutely seen it all. With the health district, she helped implement when we went from paper to electronic medical records. She basically started our translation services in our clinic, and mostly she is someone that if there was a problem, she would find a solution. And we will greatly miss Maria at the health district. Mike White is also retiring, is retired. He's an office specialist. He's worked with both CCHS and EHS. Mike knew how to get things done, and he was very instrumental in our COVID response. He was our storekeeper when the first shipment of vaccines came in, and so he definitely made the front of the paper pushing those vaccines in the door. For years of service, we have 2 supervisors from our environmental health division with a combined 40 years of service being recognized. James English has been with us for 25 years. I believe he's worked in almost every EHS program, and he's absolutely had a positive impact on public health in our community. Wesley Rubio, he has worked with NNPH for 15 years. He currently works with our Vector team and our permanent facilities, which includes facilities such as hotels, pools, tattoo parlors, and such. Then we have two individuals from air quality. Matthew McCarthy is a senior air quality specialist, has been with us for 5 years. He works on our monitoring team and is one of the individuals that lets the community know our daily air quality. And then Candace Brown, she's an environmental engineer. She's also been with us for 5 years. She is on our permitting team and ensures that our businesses have the required permits they need to be successful. So congratulations to those years of service, and we will miss those two with their retirements.
Thank you. That's amazing, like 30.5 years. I think some of the people in this room, excluding myself,
Yes.
may not even be that old.
You're aging us
excluding
today.
myself.
Great.
And congrats to everyone.
And next up is Frenchie Rubio with Health Heroes.
Hi, everyone. For the record, Frenchie Rubio. So as a member of the Health Hero Committee, we recognized for the month of July 2025, 5 Health Heroes. First one being Kayla Solorio. She was recognized for the values of collaboration and compassion, inclusivity, and trustworthiness. Kayla went above and beyond her deep understanding of the community and her willingness to do so much for the community and ensuring that all her clients meet their requirements and things like that. And then next up we have Jordan Marchi from PhD. She was recognized for the values of adaptability and collaboration. Sorry, my contacts. Jordan's efforts as a pretty much, sorry, my contact is like not working. Can't see. Huh? It's okay, yeah, no, it's because I can't really see. Yeah, hold on, sorry. My bad. Oh.
I got you.
Yeah, okay,
I
thank
got
you, sorry.
Don't worry, don't worry. So Jordan was adaptability and collaboration. Jordan's efforts are a clear example of how thoughtful innovation and collaboration can amplify our reach and effectiveness as a health district. Her work embodies NMPH's values of service, excellence, and integrity, and makes her more than deserving of recognition as a health hero. Next, we have Amanda Santos with PhD for adaptability and compassion. Amanda has consistently demonstrated strong teamwork and leadership, particularly in her role with CDIP's Power Up Kids program. She is currently leading direct education of 2 affiliated Boys and Girls Club sites where she has shown exceptional initiative and flexibility. Her dedication and adaptability have made her a vital contributor to the success of the program. And then finally, we have the 2 of Eva Sandoval and Itziana Montoya, with the Office of District Health Officer for Adaptability and Collaboration. Towards the beginning of 2025, Eva and Itziana both volunteered to lead aspects of a series of festivals in the community. Their spirit of volunteerism is all the more notable. They performed tasks such as recruiting additional volunteers, checked in hundreds of clients over the course of the various festivals, provided bilingual assistance to attending clients, and responded to the numerous demands and questions event attendees and tabling presenters have at community events. Their efforts have to date helped connect more than 1,500 clients to healthcare services and educational resources. And thanks to Frenchie for the very nice words for all those staff.
Thank you. Well, go ahead.
I was just going to say thank you, Frenchie, and for someone who wears contacts, we completely understand, so it happens, so thank you.
Well, congratulations to everyone, and thank you. So we'll move now to consent items. Does anyone have anything that they'd like to pull from consent? Not seeing that, I entertain a motion.
Move to approve?
We have a motion by Mr. Anderson, a second by Mr. Driscoll. Any opposed? All those signify by saying aye.
Aye.
Motion carries unanimously. Oh, it's displayed on the screen. Not used to it being displayed on the screen. And there you go. Thank you. Well, that's the end of consent. We'll move now to a presentation and discussion of the 2025 vector season, including surveillance, treatment, and testing. And Ms. Dixon. Lots of rain.
Lots of rain.
Lots of rain.
Lots of rain. And the team apologizes. Will is out unexpectedly today, but I did ask him about the rain, and I have his written answer right here. So I will do my best to answer your questions, but I may have to take them back to the team at the end. So as you remember from earlier this spring, we made the decision to not fund the helicopter, and we promised that we would come back and share with you the work that we've been doing, because there's a lot of work, great work that the team does outside of just the helicopter treatment. So I will try to do the team justice with this. What we're going to talk a little bit about is this service request that the team receives, our adult surveillance program, and that's adult mosquitoes, what we do to survey and then treat, and then a summary of what we've been doing so far. So our service request this year to date, this is actually probably from about 2 weeks ago when the presentation was made, and I can guarantee you that they have increased since then. So we're in alignment with previous years of how many service requests so far. Abatement's been about 34. Mosquito fish, just so as a reminder, our team does provide individuals who have ponds on their property with mosquito fish to help alleviate the mosquitoes and the larvae. So average 72, 63 last year, and 98 the year before. So our monitoring program uses different types of traps. What you have in front of you is a New Jersey trap. And basically what that is it has a light in the trap and then also a fan, which encourages mosquitoes to enter. Another word is they get sucked in. But what they do is our team then goes around and collects the traps. I'll talk to you a little bit about that in a moment. The chart you see up there as well that looks a little small is our average temperature. You also have the SLE temp, which is our St. Louis encephalitis, and that's the temp we start to worry about St. Louis encephalitis. Then the Western equine encephalitis is also listed up there for the temp. You will see the spike of mosquitoes, and if you really look at the small details, those are the different types of mosquitoes and the numbers that our team has collected. Each mosquito carries different types of disease, and that's why we break them out by type. So here are two more of the traps that we use. The one on my right is a CO2 trap, and it mimics kind of a human or an animal host through the CO2. The gravid trapping for mosquitoes, those it brings in the female mosquitoes, and it mimics a breeding ground. And so it's kind of like, it's been described as like a smelly water, so that it's a perfect breeding ground. And so this is where our team collects the mosquitoes. We have 3 different types of traps. These 2 will end a little earlier than the New Jersey trap in the season. We'll stop these first. Here is a map and a summary of our mosquito pools. So to date, about 2 weeks ago, there was 173 trap collections. Of those traps, we take those mosquitoes. We then send them we sort them, identify the mosquitoes, then we also send them to the lab. We've had 230 lab submissions so far this year, with a total of just under 4,000 mosquitoes tested. The great news is that all of our lab results so far, as of 2 weeks ago, have been negative for mosquito viruses. So then we also do treatment. So we don't do the helicopter, but we do provide larvicide treatment. So a number of other communities may spray for adult mosquitoes. We have chosen not to do that, as it does potentially harm other insects. So we use a product that specifically targets the mosquito larvicide. We've had 598 site visits, 473 mosquito control treatments, and 17 mosquito fish deliveries. So the team is super busy, even without the helicopter going, and making a difference in our community. And you can see that these are occurring all over our region. It's not just targeted in one area. So in summary, overall, our mosquito numbers have remained moderate. We've had mild summer temperatures. We will continue the adult mosquito trapping through September. And then, as I stated, those other 2 traps will stop, but we will continue the monitoring with New Jersey traps through the end of October. So as we've had a lot of rain, with recent increases in water, we are asking the community to be on the lookout for standing water that potentially isn't normally there and to address it on their own property. If it's not on their own property, to please report it so we can be aware of it. And as a reminder, we still have mosquito fish. Even though it's the end of the season, we still do have mosquito fish. And with the extra water, I apologize, but I'm just going to read this one. It's a complicated answer because our infrastructure is so diverse. In general, precipitation this time of year goes out into the above-ground stormwater infrastructure or wetlands. So most of the storm drains typically hold water year-round, anyways, from domestic sources, whether our people or irrigation overflows. The temporary increase in humidity will generally increase mosquito activity, and we will have retention and detention basins that were dry that will become flooded again. And our team is going to be on the lookout for those specific that have water when they didn't have water before. So I'm happy to answer any questions that I'm able to, but there is a plan to provide another update at the end of the season, which the season traditionally ends in October. So I hope I represented the team well for all the great work that they do, but if there's any questions, I can answer.
Thank you. Does anybody on the board have any questions? Dr. Kinsley?
Member Anderson, you can go ahead, and is that okay, Chair?
Sure.
Okay, thank you. I just wanted the board first.
Thank you, and appreciate you
didn't see him,
stepping
I
in
saw
on the presentation there. I was just wondering, with the changes that were made this summer, have we seen anything emerging on results of increases in vector-borne illnesses or anything in the region?
We have not. That's really hard to say that it wouldn't happen in the future, but due to weather is a big indicator of our mosquito populations, and so far this weather we've been very fortunate. So we haven't tested positive, and none of our mosquitoes have tested positive yet. So I don't want to say we never need to use the helicopter again, but at this point we are okay without using it.
Okay, wonderful. Thank you.
Dr. Kinsley?
Thank you. I also believe we had a short video. I just wanted to make sure.
Oh, yes. I apologize. Thank you for the reminder. The team did a social media post with a video about the traps, and this was Tyler and Megan, and we'd love to share that. Thank you for the reminder.
We're here at Lazy 5 Park, trapping mosquitoes.
There's 30 different types of mosquitoes in the northern Nevada.
We're really interested in catching the females. They're the ones that bite. The males are not. We're going to be using the gravids with some organic, some juice with organic matter in it that attracts the females. Once we trap them, we collect them, we take them back to our lab, and we identify them under the microscope and determine what species they are.
Each type of mosquito carries a different disease, so it's important for us to identify them first.
From there, once we've identified them, we take them to the lab, the animal disease lab, Department of Agriculture, and they test them for virus. We do this every week. We come out on a regular basis to different locations throughout the community. We want to make sure we're protecting our citizens.
So I believe that was posted on both our Instagram and our Facebook page.
I can guarantee it was, because I was going to bring it up before I knew that a video was going to be shown, and actually Lazy 5 is in my district, so I think it was great. Not that it has to be only in Lazy 5, but I think it was really well done, and I think it helped to also address that even though the helicopter, which created, in terms of suspending that, created a lot of buzz and concern, this video helped to address that. It's not just the helicopter that is used, by the Northern Nevada Public Health, but there are other mitigation factors. So I thought it was well done.
Yeah.
So thank you for sharing that.
Absolutely.
I do have a question.
Yes.
Because the helicopter is in this, I'll use the term pause, but for right now, it's
Pause.
not being used. And I realize that even with the rainfall that we're seeing, that comparisons year over year may have specific changes, right, in terms of weather being a factor and other things. But I'm wondering when the time is right, if we could get a comparison of, are we seeing, if we had a baseline level, even if we had to go out 5 years to blend that line for various peaks for the different factors to be considered, what kind of impact has been made by not having the helicopter? And again, I don't want to just have it be the helicopter being suspended and then we saw a spike of some sort, because there are other mitigating factors that you all at a technical level know, and I'm hoping that those can be factored in. I think it would be helpful as we look at the possibility of next year's budget when the time is right. So that's what I'd ask.
I can do that.
Thank you. Anything else?
All right.
Well, thank you so much. You did a great job. We should have asked really tougher questions. I don't know. Last chance. Any tougher questions? No. Okay. We'll end and close out item 7 and move to item 8, which is a recommendation to accept the REMSA Health Monthly Franchise Report for June 2025, which includes REMSA Health Accounts Receivable Summary, compliance by zones, average response times, incident details reporting, summary penalty fund reconciliation, ground ambulance operations report, patient experience report and comments, education report, and public relations report, and provide possible board direction. Thank you. That gave you a lot of time to walk all the way up. You could sit farther back and I could read faster. We could see who gets done first. But thank you so much.
Thank you very much. My pleasure to be here this afternoon. Good afternoon. Vice Chair Andriola, members of the board. My name is Barry Duplantis. I'm the Chief Executive Officer and President of REMSA Health, for the record. I understand that you have been provided with a copy of REMSA Health's July 2025 report. For July, which is the first month of our fiscal year this year, for July in the fiscal year to date, REMSA Health has met or exceeded franchise response compliance with priority 1 calls in all franchise zones. We were 91% in Zone A and 96% in Zones B, C, D. During the month of July, we've been quite busy. REMSA responded to 8,599 priority 1 calls and transported 5,461 patients to area hospitals, which is a bit consistent with the prior month. The summer months typically are very busy for us because we have lots of folks in town for various events that we hold. Our average response time was 6 minutes and 1 second, as compared to our standard, as expected in the franchise, a standard of 8 minutes and 59 seconds for Zone A. Our customer service report for the month of July produced a score of 93.44, which is consistent with the prior month. The highest score, which I'm pleased to say, is care shown by the medics and the skill of the person driving. Those two were in the top categories. And lastly, what I'd like to comment on is Mr. Driscoll raised a question for us a couple of meetings ago with regard to that 10% of patients where there might be some latency on arrival. And we are doing a deeper dive. I've had a discussion with Mr. Driscoll, and we're looking at the data, see if there's some trends that develop. And as we start to learn a little bit more about studying that, I will be coming back to share that data with you. That said, that concludes my report for today for this particular agenda item. I am very happy to take any questions that anyone may have.
Well, thank you for your thoroughness and summarizing the report, and thanks for always providing the detail. Does anybody have any questions for Mr. Duplantis? Well, thank you again for all you do. We appreciate it.
Our pleasure. Thank you.
Okay, we'll move. Do we have, I never remember, do we have to have public comment?
We've changed the agenda, so now you have public comment.
Okay, okay. Every board has its own, and I'm going to have to make notes for every board. No, that's fine. It is. I was just going to ask for public comment.
Madam Chair,
Yep,
I would move to approve the report as submitted.
great. We have a motion. Do we have a second? I'll second. Okay, we have a motion by Mr. Driscoll and a motion by Dr. Duarte. Any further discussion? All those in favor signify by saying aye. Aye. Any opposed? Motion carries unanimously. Thank you. So we'll move now to item number 9 for the recommendation for reappointment to the Food Protection Hearing Advisory Board. And I'm guessing you're Miss English? It was a wild guess. Thank you. Welcome.
Thank you. Good afternoon, Vice Chair and members of the board. For the record, Amber English, Environmental Health Specialist Supervisor. So the item before you is our recommendation for the reappointment of 4 current members to the Food Protection Hearing and Advisory Board, Mr. Michael Chomp, Mr. J.P. Pinocchio, Mr. Christopher Rahm, and Mr. Chris Thompson, for new 3-year terms retroactive to July 1st, 2025 through June 30th, 2028. As outlined in our food establishment regulation, this board plays a critical role in hearing appeals and reviewing variance requests, which requires both a commitment to public service and technical expertise in food safety and operations. As you can see in your packet, each of these members brings exceptional qualifications, diverse industry experience, and a record of meaningful participation on the board. Their reappointment will ensure continuity, preserve the institutional knowledge, and maintain a well-rounded representation of our local food industry. Our recommendation is based on careful consideration of the applicant pool against established criteria, and for these reasons, we recommend the reappointment of all 4 members for new 3-year terms. Thank you, and I'd be happy to answer any questions.
Do you have any questions for Ms. English? Hearing none, I'll entertain a motion to approve the 4 reappointments as presented.
Move to approve?
We have a motion by Mr. Anderson. We have a second?
Second.
Second by Mr. Driscoll. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Oh, it's on your screen. I think it's going to be motion carries unanimously. It's a wild guess. Yes, great. So thank you.
Thank you.
We'll move now to staff reports. Item 10A is the air quality management. EPA proposes repeal of greenhouse gas regulation. And Mr. Vega.
Thank you, Madam Vice Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. Just a couple of highlights on the report. As you just read, we did provide some information on the proposal from the EPA to repeal the endangerment finding for greenhouse gas emissions on public health. That's important for us because that is what is really utilized to set emission standards for vehicles, which we know the transportation sector is the largest contributor to air quality in Washoe County. So that's why we wanted to provide that information for the board. Also, some positive news on the budget front. The latest information out of the appropriations and the Congress is that they are recommending essentially flat funding for EPA categorical grants, which is really good news for us. I will say we're probably not out of the water just yet. We have applied for both of our EPA grants for the following fiscal year, but we have yet to receive an award. And our larger award, which is our EPA 105 grant, even though the federal fiscal year runs from October through September, of 2026, we typically don't get that award until August. So definitely still some risk associated with those. So we're trying to do what we can to kind of mitigate some of that. But did want to provide that information. Again, the news is more positive than what we were hearing back in, June. In the month of July, we did experience one exceedance of the ozone standard, and we have found that data from the Green Fire kind of contributed to that ozone exceedance. And then lastly, I'm happy to report that once again, we were at 100% timely completion on our plan reviews. So that is my update. Happy to answer any questions.
Thank you, Mr. Vega. Any questions? Dr. Duarte.
Yeah, I have a question. What do you anticipate the changes in the air quality mandates regarding automobiles? How is that going to impact air quality in Washoe County? Can you make any prognostication about that?
Yes, that's an excellent question. It's difficult to answer at this point. What we do know is that the standards that are set by the federal government, because Washoe County has become such a major kind of connection point for heavy-duty vehicles bringing goods through this region from the Port of Oakland. Again, if those standards kind of go away, we would anticipate air quality, being worsened. But again, it's kind of difficult to say.
Do you anticipate any increase or change in ozone as an example?
Again, it's so many factors going into the formation of ozone. You could probably make the qualitative, analysis that, lesser vehicle standards is going to contribute to more ozone. But again, it's such a complex, chemical kind of reaction that contributes to ozone formation that it'd be very hard for me to come up here and say, with 100% confidence that we're going to see an increase.
Well, my understanding was that the standards were imposed, what was it, in 2010?
Yeah, for ozone, I believe it was set in 2015.
Okay,
Yeah.
and so what the data before that, does that inform us in any way? Is that helpful to look at?
Yeah, all the data is very informative, and actually, the committee who sets the standards at their last review actually determined or recommended to EPA to strengthen the ozone standard from the 2015, which was set at 70 ppb. They actually recommended a standard in the range from like 65 to 67. Again, our data, if you look at our monitoring data from Washoe County, we're right at 70 ppb. So if the standard was to be strengthened, again, we would probably be exceeding that. Yeah.
Thank you very much.
Yeah, of course.
Thank you. Any other questions? Thank you, Mr. Vega.
For the record, Dr. Danko joined at 1:30.
Oh, great. Can you hear us okay, Mr. Danko, or Dr. Danko? Easy for me to say. Just making sure that she can hear us and we can hear her. She cannot?
She cannot unmute, but she can hear us.
Okay, that's good.
Thank you.
Thank you. All right, we'll move now to item 10B, which is the Community and Health Services National Immunization Awareness Month. Ms. Shepard, hi.
Hi. Good afternoon, members of the board. For the record, Christina Shepard, Division Director of Community and Clinical Health Services. This month, our report spotlighted the work of our immunization program in recognition of National Immunization Awareness Month. Our team has been wrapping up a very busy back-to-school season. We have hosted 2 Saturday immunization events this month where we provided 475 vaccines to 193 school-aged children. On top of that, our clinic has been steadily busy with both scheduled and walk-in appointments for kids needing school-required vaccines. I also want to take a moment to highlight the incredible outreach efforts our immunization team has made over the past year. They've participated in 37 outreach events, 12 of which were held directly at schools, bringing vaccines to where people are and making access as easy as possible. We're proud of their dedication and their impact on the community, and we look forward to their continuing work in the months ahead as we get into respiratory season. Thank you very much, and I am happy to answer any questions on my report.
Thank you. Sounds like you've been busy with outreach
Yeah.
and vaccines. Any questions for Ms. Shepherd? Dr. Kinsley?
Yeah, I'd just like to add to that, and this is part of the process, and we are always engaged as much as we can with our community. Due to previous cutbacks through the federal government that affected our budget, we will have some limited capacity and towards being able to do outreach. Now we've reached the end of our budget for outreach, so we have reached that point. As always, we work with our community and those partners as we can to provide information and where we'll be able to. But we're continuing to monitor that, and any updates we'll be able to provide to the board. But just know that if we can't be there in the community, we are still engaged as best we can with our stakeholders.
Thank you. Thank you.
Thank you.
We'll move now to 10C, the Environmental Health Services Program, Consumer Protection Safety Plan Review and Operations, Commercial Plan Review, Foodborne Illness, and a lot more.
Good afternoon
and you
again.
are not Mr. Fido, so
No.
Miss English.
Yes, good afternoon again. For the record, Amber English, Environmental Health Specialist Supervisor. So just a few things I wanted to highlight out of the DD report for today. One is that we're excited to share, we just heard about what our Vector program is doing as far as mosquito abatement. Another project they've been working on is partnering with our epidemiology and informatics departments, as well as Washoe County Animal Services to create a new regional reporting and surveillance tool for rabies. This system will improve early detection and response across northern Nevada and help us safeguard both the public health and animal health. It's also a great example of cross-department collaboration. Another exciting accomplishment was the plan review for two major hospitality projects, the Grand Sierra Resort's new arena, which is expected to house over 30 food establishments, and the Cal Neva Resort in Crystal Bay, which will also include close to 20 facilities. And these projects involve close coordination not only with our own internal teams, but also partner agencies such as Placer County Environmental Health and the local building departments. And another great example of just proactive collaboration that ensures these businesses are set up for success with the best standards for public health. And then last, I just wanted to highlight that this past month, one of our inspectors received a heartfelt praise from an apartment complex for going above and beyond to help them navigate the steps to open their facility. The feedback highlighted that the inspector's problem-solving approach and dedication. In another instance, that same inspector rescued a 4-week-old kitten from a fountain and personally ensured that the kitten received care and home. And I just wanted to highlight that these moments remind us that the work we do is about more than compliance, but it's also about service to our community and compassion as well. And I'm happy to answer any questions. Thanks.
Thank you. Any questions? Mr. Driscoll?
Not a question, but a statement. I noticed that we had Mr. Stokes finish the Food Safety Inspection Officer Standardization Program. That's something that we've been talking about for a long time, to where our restaurant facilities have a reasonable belief that it doesn't matter who's walking through the door, that the inspection standardization will be there, and that the things they're asked to do from inspection to inspection will be consistent as well. So I'm very pleased that that is moving along, and that's becoming part of our day-to-day inspection process, as I believe that all of our customers appreciate that standardization. So,
yes, thank you for that. Absolutely. And that is, standardization is one of those things that is important to us, but one of those things that also sometimes gets pushed off with all of our other competing priorities. So we're happy that we're able to bring that back to the table. Thank you.
Hold on. Dr. Duarte?
Yes. Good afternoon. Thank you. I was reviewing the report. I have an interest in knowing more about the PFAS chemicals in our drinking water, and I didn't see any data about it. And I would just like to ask if we could get some additional information about that at future meetings.
Absolutely. I will
Thank you very much.
Take that back to the team. Thank you.
Thank you. Mr. Anderson?
First, a statement, and I hope I get the name right. I was talking to a business in Sparks that had been recently inspected, and they wanted to speak, or they spoke very highly of one of the inspectors. I think that her name was Lauren, and said that she went above and beyond, not just doing the inspection, but getting to understand them and their business and how they were doing it. And then they felt that she really did a great job of coming alongside them to make sure they were doing it the best possible way. And so I just wanted to give a shout out to her and let you guys know about that compliment. I thought that was pretty cool. And then secondly, just had a question in regard to some of us received an email where some folks feel that some are maybe just snubbing inspections and aren't too concerned about them. But are you seeing a trend in compliance or any decrease in compliance within the county and inspections?
So I think I know what email you're referring to, and I think that's stemming from the Reno Gazette-Journal, who is only, that publication is only posting they only ask for the inspection scores that are either conditional pass, failed, or closed, and so they're not highlighting the facilities that also do well. We're at least an 85% pass rate overall, and that has been consistent for the last few years, and that's also should be in your ClearPoint reporting for the strategic plan if you want to look at more details, but our overall pass rate is in like close to 85-90%.
Perfect. That's what I was looking for. Appreciate it.
I have a question. Well, I have a comment now based on just piggybacking off of that. I realize that whoever is the publication is, going to publicize whatever the information is, but maybe providing that stat that you just said might be, even if it's a small little piece, and maybe you already have, but I know that reporters and journalists are always dedicated to facts, always.
Yes, and I can guarantee you
Always.
we have highlighted the positive as well.
And maybe including facts might also be an encouragement to people, knowing that although some of the things are highlighted and it's public information, certainly, and the public should be aware of it, but facts matter, and so I'm just encouraging maybe that opportunity if you see fit.
So we have attempted that. I do think that there's opportunities for us to publish that on our own if it's not getting published through the publications that we've asked to publish that. So I think that's a great suggestion we can take back. Thank you.
I'm going to reserve my comment for the headline I think you might include in your publication. I think I best just say that I think that's a great idea, but I think it's always nice. Sometimes you never know. And I'm always an optimist when it comes to just try. And I do think that sometimes the message may just be inadvertently missed, and I think it's a great opportunity to share. I also think it's a great opportunity to share some of the things that you're sharing with us, whether it be the compliment that was given, whether it be the kitten that was rescued. I think that the team here does a great job on social media. As I mentioned, I follow it. So like I said, I had already seen that and commented it appropriately. But I do think that it's never a missed opportunity to share facts, and I think that might be a nice compliment as well. So I do have a question, though.
Yes.
On the animal services surveillance, can you just explain that a little bit?
On the animal services surveillance, this is really related to vector animals like rodents that would carry rabies.
Okay.
Yeah.
Okay.
So it's just in collaboration with our vector
Animal
program
services.
and animal services.
Okay. So there's really nothing that's necessarily changed with that?
I think it's just an enhanced system for how we're surveying
Okay.
and
So working stronger
yes.
together?
And I don't know if, Ms. Dow can clarify since her department, since her department is also working
Well, I'll
with
just
us.
talk to you guys offline on it. I'm on the Animal Services Board, so that's why I was asking.
Okay.
I was just really curious, unless everyone would like to hear. I don't want to deprive anybody of hearing all the details. If not, I'll just say thank you, Ms. English, if there's not any other questions, and thank you for, I'll be watching the headline.
Okay.
I'll be
All right.
watching for the headline.
Fingers
Maybe you
crossed,
can
yeah.
share when that's published so we can do our part to also share all the facts because we know they're always reported accurately. Thank you.
Thank you.
We'll move now to item 10D, Population Health by Dr. Deo. And I never want to skip Dr. Danko. And if she does have any questions, I hope there's an opportunity for you to let me know. Thank you.
Good afternoon.
Hi.
Members of the board, this is Nancy Dow, Division Director of Population Health. You have my report. I don't have anything to change to add, just a few highlights of what's been happening more recently. So in public health preparedness, we collaborated with Washoe County Technology Services on July 31st and conducted a Cyber Ready game session with participation from NNPH's own TS team and as well as County TS. And this Cyber Ready community game was a tabletop strategy board game that was developed by Cybersecurity and Infrastructure Security Agency and FEMA to promote cyber readiness within our communities. Our TS participants in this session split into groups and played 4 simultaneous board games together with each different scenarios and challenges. So the goal of this was to increase cyber awareness by simulating realistic scenarios that prompted discussion around infrastructure, response strategies, and best practices. And this effort is a proactive step towards building a stronger cybersecurity culture and enhancing preparedness across our organizations. In our chronic disease and injury prevention team, for the first time this summer, the team expanded the Power Up Kids program activities beyond the traditional school year schedule and offered this during the summer month in partnership with the Boys and Girls Club of Truckee Meadows across 2 affiliated sites. The program educates students on the importance of healthy eating and the importance of being active. So over 160 students were reached in the summer sessions, and this feeds into addressing the gap in physical education funding and the rise in childhood obesity that we're seeing. And with our CDIP team, the ultimate goal always is not only to improve individual health behaviors, but also to reduce the burden of chronic disease across our communities over time. And then in epidemiology, after 2 weeks of lower outbreak numbers, we have seen a noticeable increase in recent weeks with schools back in session. The majority of outbreaks in August we're seeing so far are of gastrointestinal illness. And since early August, we're now seeing upticks in our COVID-19 activities, including our syndromic surveillance and hospitalizations, likely coinciding with the circulation of the new XFG variants that's happening across the nation. And it does also follow national trends with this increase. But our rates and numbers are still relatively low in the broader context. And our EPI team are also producing a pertussis EPI news that's coming out either today or tomorrow in terms of, because we're seeing for those respiratory symptoms, there's also a noted increase recently in pertussis cases in our community. And that's all my updates. I'm happy to answer any questions. And then just to add on to the question on animal services, what we're doing is that the epidemiology team, in collaboration with our EHS vector team, as well as animal services, is trying to help using our informatic resources with the reporting from the community to make it easier. Because our team in epidemiology side works on the human recommendation of PEP, investigation of human cases, but there is the animal component that's also being done from the environmental health services side and with animal services. So there is multiple factors that comes in when animal bite is reported, and we're trying to streamline this opportunity for public reporting for our internal collaboration so that it's easier, and also for data that we can produce on dashboards and analytical purposes.
Thank you. I just want to say thank you for that explanation. And I think anytime you can strengthen the relationships between agencies and then the community ends up benefiting as well. So thanks for that clarification. I appreciate it. Are there any questions, Mr. Driscoll?
So there's a lot of turmoil at CDC on a national basis, including the directors got a job, doesn't have a job in the last couple of days.
Mm-hmm.
But one of the articles that came out recently in the last week talked about that the vaccination board, if you will, is not recommending a change to the COVID vaccine, which means it's not taking into effect the latest variant. They also suggested in the last couple of days that the vaccines really should be for people 65 and older or younger that have underlying medical issues. Those things all in kind of a row, if we will, does that cause us concern to think that while we're matching trends as to when we're getting COVID and how much, that because the new variant's not taken into effect, that we may have a larger number of COVID sufferers in the cycles that we normally see?
The recommendation right now was the only 65 and above that can get the vaccine, or if, like you mentioned, younger who has underlying health conditions. For us, we are still digesting this change that's coming in, but it does, on some levels, cause a little concern for those with younger that doesn't have the underlying health conditions, because when we're seeing nationally for COVID death numbers, it actually, for those who are younger than 5, it actually wasn't lower than flu in the past season. And so that is something also for us to consider.
Thank you.
Dr. Duarte.
Yes, good afternoon, Dr. Dow. For my information, were the pertussis cases in older people or were they in the younger population? Does this suggest that our older people are not getting a DPT vaccination, or are we looking at an overlap with not getting measles immunizations?
It has not been specifically to the older population for our cases right now. We do want to encourage the Tdap, DDAP, that, and also to keep that up to date with your 10-year recurrence.
Thank you very much.
Okay. Did you want Dr. Kinsley?
And sorry, Dr. Dow, I didn't prep you for this conversation, but also in the news that they've noticed here in Nevada, due to mentioning cybersecurity, the state is undergoing some challenges right now where they're not able to access many of their databases. But just want to assure the community, from my understanding, currently our vital records, both our death and birth certificates, has not been affected, and we are able to provide those services to the community, correct?
Yes.
Okay. I just wanted to clarify that, since many have been reported that state is inaccessible right now, but those records are accessible to our community, and we are open.
That's really helpful, and I wonder again if there might be an opportunity to share that, because I had wrote down about the cyber readiness. The timing of that seems to be more than readiness. It's probably going to have some really systemic changes in a lot of things. And so I think it's really important, because you clarifying that as an example, I just read a briefing and I really took it as those weren't available. And I'm not saying that I read it accurately, but I think in the spirit of journalism and facts, I'm on some type of trend here with journalism and facts. But I do think that that would be really important, because there's so much information about this happening and what is accessible and what isn't accessible. And if people are wanting to get records for whatever reason, even though things are where they're at in whatever point of time at this moment, it doesn't stop that particular need. And if people are thinking they're not available and they really are, I think that would be important to share. If you so desire, I do think it would be helpful.
Thank you for that.
Anything else? Great. Thank you,
Thank
Dr.
you.
Dow. We'll move now to 10E, Office of the District Health Officer Report. Dr. Kinsley.
Great, thank you. Actually, both things were organically kind of brought up, but just again, the state outage cybersecurity for any community members out there, as we're District Board Health members, is it's an ongoing process, but we're watching it closely and working with our state partners. And then also just recognizing that, yes, as of yesterday, there have been changes within the CDC. This is many situations as we go through those kind of crystal ball situations that there's not an immediate impact, but we will continue to monitor as we have. There's many things going on that we continue to monitor, as well as for our future budgets and that affect us, but it's kind of a trickle down. We have usually a long period after waiting to see where we're and how do we adapt. And but for those points, just wanted to give a few updates from the report, and over on as well as our TB clinic, if you've noticed closely to here, is progressing well. It will not be delayed, and so we're excited for that as it continues to progress, and still looking hopefully for a February time that our staff will be moving over to there, February, March, around there. But it should be completing towards December, January. So excited for that. There's been a lot of announcements, but there's our community health assessment. It's a 3-year cycle where we go out to our community and ask those questions, really, where are you looking for health improvement? What is infecting you? What impacts do you have? And we're doing that in conjunction with Renown. All nonprofit hospitals also have to do a community health assessment every 3 years. So again, doing a synergistic approach so we don't duplicate our efforts. And many of those community workshops and meetings will be occurring in September. Those are available on our website as well as our social media for information to be able to enroll in those, but encourage any members of our community that would like to participate. Those are available, and this is what drives many of our efforts, our community health improvement plan for the next 3 years. So just want to be able to announce that. And then lastly, just to touch base, we have these family health festivals 4 times a year. Our last one occurred in July at Hug High School. Just overall some numbers on that. Over 400 households attended, was about almost 1,500 members that were there, 47 healthcare, education, and general community resource partners in attendance. Did 51 haircuts and 150 haircut vouchers given. 112 individuals received blood pressure screenings, 20 on-the-spot legal consults. Almost 300 families received mobile harvest, and 152 total vaccinations provided during those times. And then just there's some information, 72% of household individuals have a primary care doctor. 77% of household individuals have health care insurance, including Medicaid and Medicare. And on average, we're seeing about a 4 average household size right now in our community that are attending these. So just wanted to highlight the great work that many of our teams come together to help provide this 4 times a year for our community. So there's a wonderful outreach that's been going on for a long time. But we're always happy to see these numbers returning, especially we say these are our numbers are pre-COVID. We're back to those numbers again on helping our community members. So thank you, and take any questions at this time.
Any questions for Dr. Kinsley? I have a quick question. Based on your earlier comment in terms of the outreach being reduced, is this part of what you explained? Will this, for instance, this Family Health Festival that you are providing to us, is that an impact that is going to be a result of what you mentioned earlier?
I would have to speak specifically to Christine. I do believe that staff, and I'll have Christine come with that. I don't think it would be an impact directly for this, as many of these costs are covered through a different grant or budget cycle. But I'll have her touch base on just the overall budget, just to clarify and help us understanding our community impact. I'd like her to be able to mention on that.
Sure. Christina Shepard, Division Director of Community and Clinical Health Services, for the record. We are scaling back our outreach services. Our plan is to continue to deliver vaccination services at our family health festivals, which occur 4 times a year. Where we are going to see the biggest impacts is in those school-located vaccine clinics that we were able to do last year. So last year, we were able to do 12 at feeder schools, so at like middle and high schools that were feeder schools for 2 or 3 elementary schools. That's where we're going to see the most significant impact. So we're looking at doing really 2 very targeted school-located vaccine clinics this year. Our biggest one last year was at Worcester High School, so probably looking in those kind of underserved areas to target our school-located vaccine clinics for this year, but looking at probably 2 at the most instead of the 12 that we were able to do last year.
Okay, thanks for the clarification, because outreach is a big topic, and I wasn't sure exactly what that encompassed. And so I'm sure there are plans to even reach out to the school district and see if there's opportunities for them to look at some joint collaborative things, but I'll leave that to the experts.
Yeah, and they did a lot with Community Health Alliance this year as a good
Great.
community partner for back to school. So looking at all our other community partners that are able to provide those services as well.
Thank you, Ms. Shepard. Thanks for all you do. Thanks. Dr. Duarte.
I just wanted to chime in and say thank you, Dr. Kingsley, to you and your staff, the outreach and getting healthcare services out to the community and screenings is really wonderful. Much appreciated. Thank you very much.
Prevention, prevention, prevention. Yes. All right, we'll now move to public comment, item 11.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. Zoom users may log in via the provided link and utilize the raise hand feature during any public comment period. Reasonable efforts will be made to hear all public comment during the meeting. We do not have any Zoom users requesting public comment, and there is no other registered public comment.
Thank you. Seeing none, we'll close public comment and move now to board comment. I feel I should go to Dr. Danko. Do you have any board comment that you'd like to offer? Any announcements or reports, updates, requests for information?
She says no questions. Thank you. Have a wonderful afternoon.
I heard that loud and clear. Thank you. Thank you, Dr. Danko, for joining us. Dr. Duarte, do you have anything? No. Mr. Driscoll? Mr. Anderson? I have an announcement. If you haven't heard, we've had a little bit of rain, and as a result, Tumwa is asking that we not water. Due to the turbidity and the flow that is coming in at a rapid rate, and it was originally to restrict water use, and now it's no water. And I'm not talking about in-home. I'm talking about watering your lawn and outside water. So I would encourage you to either look at Tumwa or social media, and I don't know how long that is going to be in place, but they are asking for everyone's cooperation with that. So, anything else? Boy, if I didn't have a comment, we would have ended at 2, but we're ending at 2:02. This meeting is closed. Thank you.